when we have had this afternoon lectures talking about the same topic from various aspects. And what I try to do now is probably to wrap it up, to of course give you, let's say, my experience in that field. I also give you some of the long-term documentation we have with our treatment pool that has been documented for 15 years now altogether. And of course, it will also include the ITI treatment philosophy that has been discussed at three different ITI consensus conferences. And again, I offer you the handout. I think I'm going to show it at the end as well, and then we will see. Okay, what's the topic today? This topic, or this lecture, will just talk about single tooth extraction, also not multiple teeth, that's a different story. Aesthetic zone, that's not the first molar in the mandible, of course. You as a clinician, when you have these kind of patients in your office, you should make up your mind what to do before you pull the tooth. Because you have three different treatment options, as I will show you. One is immediate, one is early or late. I also would like to ask you to use this terminology. The topic, or let's say the name, delayed placement is a complete nonsense, because delayed means that's day after extraction or 50 years after extraction. It's always delayed. So ITI had long discussions on this nomenclature, why not delayed or immediate delayed. These kind of terms are not very precise. When we say immediate, early or late, that actually is much more accurate. That's why ITI terminology is using these three terms.